The Health Department has called for caution over the suspicion of Nipah virus infection in 2 recent deaths in Kerala's Kozhikode district. Now, State Health Minister Veena George has held a high-level meeting and reviewed the situation. The Health Department has said that an advisory has been issued after these 2 unnatural deaths following fever that were reported in a private hospital, and that it is suspected the deaths were caused due to Nipah virus. I have my colleague Uma joining us on the broadcast. Uma, take us through now what has come out of this high-level meeting that was held by the Health Ministry in Kerala.
What they've decided is that there will be an isolation center that will be started inside the Kozhikode Medical College, because very, very critical that people, whoever has had contact, there will be contact tracing, and whoever has had contact needs to be isolated, because even though this virus does not spread like the way the COVID-19 virus spreads, that immediately when you have contact, you have exposure, there would be an infection. So while the spread is not so fast, but the mortality rate in this case is very, very high, and 80% is what is the mortality rate, and therefore the worry that whoever gets exposed to it could be at a high risk. And what we are being told is that the first death had occurred on the 30th of August of a 49-year-old man, and the second death happened yesterday of a younger man, and both of them had been in contact, and subsequently 3 family members of the first person have been put in hospital, including 2 small children, and 9 years and 4 years old, and also a 25-year-old man, we are told, and one of them is critical in the ICU. There is also a 10-month-old child who's been isolated and showing certain symptoms of the disease. What we do understand is that Kozhikode, as we know, has been the center for the outbreak of the Nipah virus. It happened in 2018 and again in 2021, and at that time, in fact, 17 people had died in 2018 when this happened, and at least 23 people were were said to have had the Nipah virus at that time. Now, what I must point out is that while on the basis of clinical symptoms, that's what the doctors are saying, that this could be, unnatural deaths and therefore related to Nipah virus. The lab reports are still awaited from NIV of both the people who have died as well as the 3 others who are showing the symptoms, and those results are awaited from NIV Pune. In the meantime, the body has been kept without cremating, because they want to first ascertain how the death has happened before the last rites can be performed. So while the contact tracing is the critical part of it, and they do not believe that this is going to become something that could spread, but the Kerala government obviously not wanting to take any chances, and that's the reason why we have seen Veena George go there and say that they will be looking at strategies following the protocol that Kerala government already has on the Nipah virus. Back to you.